Now, what exactly is glaucoma? So, glaucoma basically is a condition where the pressure in your eye increases and that damages the optic nerve of your eye, which is what I showed you all in the initial picture, which transmits the signals to your brain, and that's how we can perceive images. Now, what causes this pressure to rise? So, there is a certain fluid which circulates in your eyes, and any obstruction to the outflow of this fluid, be it in the manner of a narrow tunnel or a narrow passage or any obstruction in the pathway, causes the fluid to circulate in your eye and not move freely. That causes the pressure to build up in your eye, and that damages the optic nerve. So, this is essentially what is glaucoma. Now, glaucoma is often called the silent thief of sight. Why is this? Because glaucoma generally affects your peripheral vision first. So when you're looking straight ahead, you will not be able to see cars coming from the side, or you will not, when you're climbing down, you may not be able to see the lower stairs. You may not realize at that point of time. Most patients don't realize this. When do they present to us? They present to us at a stage when their central vision is affected. And this is when 80 to 90% of your nerve fibers have already been damaged. So that is why it is called the silent thief of sight. Please remember, in glaucoma, there is a gradual loss of vision. It is more of a peripheral vision which is lost initially. And more importantly, this vision loss is irreversible. So when you come to us with your central vision loss and with 80 to 90% of your nerve fibers damaged, we cannot do anything to reverse it. All we can do is preserve the 10-20% that you have left. Now, there is one condition which is called an acute angle closure attack, wherein the pathway gets obstructed suddenly, and you can mainly in dim light conditions, and you can have severe pain, headache, vomiting, redness, severely decreased vision. So if that happens, I would say please consult your ophthalmologist immediately. So that is basically the symptoms of glaucoma. Now, as I said, it is a slowly progressive disease and it is irreversible. So if I would, it's also a familial disease, in the sense if you have a family history of someone who has glaucoma in the family, please ensure that you get yourselves checked. So one thing I would advise everyone is, post the age of around 40 years, I would say please get your eyes checked. It's a basic examination to rule out glaucoma. We don't need to do any fancy tests. All we need to do is go to the ophthalmologist. They will check your pressures and they will check your optic nerve, as I showed you, which is the main nerve of your eye. They will put drops in your eyes, dilate your eyes, and check the main optic nerve. And then if you are suspected to have glaucoma, then of course we will have to do a few investigations. Now, the primary treatment of glaucoma is medical. There are an whole array of drops available, and they can be used to control your pressures. If this does not work, then your surgeon would take a call to go in for surgical management. But that would happen with time. What is more important is early diagnosis. So that was a little brief about glaucoma. Now, what are we discussing here? Let's see. Let's talk about diabetes. Let's talk about hypertension. Why am I discussing these diseases in ophthalmology? Do they have any connection? Yes, of course. So diabetes and hypertension are essentially vascular disorders, which means they affect the blood vessels of honestly every organ of your body. So the eye is also not spared. As you can see here, this is your retina and these are your blood vessels. Now, in any vascular disorder, as in diabetes or hypertension, if these blood vessels are affected, there may be a leakage, there may be hemorrhages, and that leaking of fluid or blood may cause edema, may cause swelling in your eye, which will again hamper the signals that are transmitted to your brain and cause blurred vision. So it is essential to get your vision, get your retina checked. If you have diabetes or hypertension, I would recommend at least a yearly examination, even if these are well controlled. The chances of having retinal issues with diabetes or hypertension are obviously when it is more long-standing or in an uncontrolled diabetic. But irrespective, I feel every year at least get an ophthalmic evaluation done. In fact, we have had patients who have come to us when we are doing a retinal examination and we say, hey, you've got changes of diabetes in your eye. And they're like, no, I don't have diabetes. But when was it last checked? 4 years ago. What has happened in those 4 years? And then they go in for a blood test and we realize that their sugars are elevated and then they take treatment for diabetes.